Are you a life science professional? Stay on top of things and keep up with the rapid changes and innovations within the industry. Value Do engages with experts and peers on various life sciences topics. Join Life Sciences Value Share today.
Hello, viewers. This is Gaurav Kandhari, once again from Value Do Life Sciences Consulting. Again, back to the Life Sciences Value Share podcast. I have with me a very close friend and an industry professional, Melissa Fellner, who spent 20 plus years in the pharmaceutical industry, starting as a scientist in clinical trial management space, moving on to managing market access and then patient services roles, then graduating to HCP and consumer marketing roles, and now is a senior marketing leader in the global role at AstraZeneca here in US. Very warm welcome to you, Melissa, and thanks for taking the time.
Thanks for having me, Gaurav. It's great to see you.
Likewise. So yeah, I mean, what we want to cover today is a very interesting topic, very evolving and a futuristic topic, as some of the industry professionals say, in pharma industry at least. So we are going to cover omni-channel marketing and omni-channel HCP engagement in the pharma industry. So for that, what we have done is we have decided to do a two-part episodes with Melissa, and she's kindly agreed to do 2 episodes, where on the first episode, we cover what is omnichannel, what's the fuss about omnichannel, how is it different from what we have been doing till now in terms of HCP engagement, moving on to why omnichannel, and then why omnichannel in pharma and why is it relevant. So that would be episode 1. Episode 2, we are going to deep dive more into the how of omnichannel. So if omnichannel is important, how do the marketeers, the medical affairs folks, and the cross-functional teams, and even the sales organization should be looking at omnichannel and using that to, benefit, from it from a customer engagement perspective. So the how, and probably we'll end up with some best practices, some, lessons that we have learned in omnichannel. Both Melissa and, and Value Do team have worked on different omnichannel initiatives. And we'll probably try to bring some of those learnings to you as to end that episode 2. So let me take a pause there and ask you, Melissa, anything else you wanted to highlight before we jump into episode number 1?
I think that's a pretty comprehensive list. Let's start with that.
All righty, super. Thank you, Melissa. So what do you think, Melissa, when, and I know, we have done some work together, but you've almost become like a pioneer in omnichannel marketing space. You have spoken and written also in different forums. So what comes to your mind when we use the word omnichannel?
I get asked this question a lot. What is omnichannel, and how is pharma doing omnichannel these days? And I both love and hate this question. So I'll tell you why. I love this question because it means that someone's starting to think about their customer and how to create the right experience for their customer. And they're hearing buzzwords like omnichannel and saying, how do I do that? I think that makes a customer's experience better, and it helps my brand, it helps my service. What is that? How do I get that? How do I do that? And so I love it for that reason. I hate it because there's not really one single definition. And there's so many gradients of omnichannel. And Gaurav, we've had this debate over and over of what is that line of doing multi-channel to omnichannel? Is it the number of channels that you've connected? Is it the data that's flowing? Is it automation? Is it using a certain type of technology? Is it having the right cross-functional teams all involved in participating in that engagement and that experience? So there's not one single answer, but I think that what matters at the end of the day is what your customers receive, what they feel with your brand engagement. And if it feels omni-channel, if it's the pinnacle of them driving what that brand does for them with your engagement reacting to their needs and meeting their needs, it doesn't really matter what else is happening behind the scenes to create that. But I will say there is some consensus around factors of channels and mixes and automation so that this happens seamlessly, that you may say and may see as some parts of the definition. But to me, it's really about, is your experience creating and meeting the needs of your customers?
Yeah, no, that's well articulated. So you said something interesting that I want to follow up on. Multi-channel or multi-channel in different parts of the world, as I said, versus omni-channel. And the other way some of the folks ask this question is, what are we doing differently? So you are still, so it's a fancy word, omni-channel, but how is it different from multi-channel? What's your view on that?
The way that I describe multi-channel and the difference between omni-channel is multi-channel is where you're using different channels to reach your customer, to give them the messages that you want them to have. And there's ways to create a good experience doing that, and you can create a consistent story through those channels. And that's one of the most obvious areas when a brand is not meeting their customers' needs, is when they get different information in different channels or it's disjointed. So there are ways to create a very orchestrated experience through multi-channel. Omni-channel, the biggest difference is that each engagement builds on the last one and is meeting a customer's need that might even evolve or change throughout time in the relationship they have with a brand or a service. And that meeting their need and understanding and knowing what happened before, how that customer reacted and what they need next, that idea of next best action, next best channel, next best moment, next best message and content and service is really the epitome of omnichannel. And that's what's really different than multi-channel.
Yeah, and I mean, I'll be paraphrasing when I say this, but in a way, pharma industry has been driven very product-centric way. You know, it's always, almost every time been about the product. The rep goes in front of the HCP, says, I have this to sell. This is going to help your patient. I've got a lot of good data and science behind it. So please prescribe it. It's nothing about the customer. It's nothing about what the HCP is preferring in terms of the content, in terms of the channel, even in terms of what they want to listen to. You know, and do they want to listen to the science behind the product, or do they want to listen to the benefits for their patients? So you're almost saying multi-channel to omni-channel is a step in the direction of thinking more customer-centric, more personalized content and channels for the customer versus product-centric, which is like you have a product, you have multiple channels, and you're going to throw all at your customer and see if something sticks. You know, and they'll end up prescribing your product. I know I'm being almost ruthless in saying that, but I just wanted to kind of connect those.
A little extreme, but I see your points that you're trying to make with that. And I agree, it's very historically been a very product-focused industry, disease education and product, and selling your key messages. And we evaluate our success many times we have based on the key messages being remembered and regurgitated back by doctors. Message recall has been a big KPI used to show success. At the end of the day, is it really meeting your needs, and is it really changing behavior? If you don't look at that, you're never going to know. If you don't measure it, you're never going to know if it's actually working. And this idea has really come through much more strongly over the past few years in the pharma industry, with patient centricity and this idea of really having a North Star on the customer and who you're helping, what they really need in life, and how we can do more than provide a medicine or a message about something to help them live in a better way than they ever thought possible. And I think that when I've evaluated what's happening across the industry, we see that about 5% of companies are all in, are really racing ahead with leveraging technology and full omni-channel automated AI integration to create that very experienced and very personalized customer experience that is based on a lot of data and even thinking and forecasting what somebody might need. Then there's the majority who are in the multi-channel space and starting to integrate a bit more to get to that more customer-centric lens. It requires huge transformations in companies, and the bigger pharma have more resources than a smaller biotech, but at the same time, it's also like pushing a boulder uphill. And then there's a subset of companies that are saying, we just can't invest or do a lot about this at this time. We'll continue doing what we've been doing, and that's working for us. So you definitely see that bell curve of adoption. And a lot of the adoption is not necessarily the technology. The technology exists and it has existed. It's how you use it. What do you use it to do? And there's still rules and compliance aspects that are being worked out about what data can be shared between team members, between channels, what can be used in what way, how long you have to keep the data, how do you safeguard the data, how do you make sure that you can't identify any person through the data. So there's a lot of aspects that need to be determined in order to use some of these technology and data in these new ways.
Yeah, I mean, you almost kind of read my mind. I mean, this is a good segue into the question about, I mean, we understand pharma industry is regulated. There's a lot of compliance. We're talking about patient identified information. We are talking about data privacy at a different level as compared to the consumer industry. But how do you feel about pharma versus non-pharma? The Amazons and the Googles of the world have really embraced omnichannel for the past few years. Anything that comes to your mind in terms of what we can learn from ex-pharma?
Yeah, and I get this question a lot as well. It's like, well, why can't you do what Amazon does? And in some ways, I'm jealous of non-pharma. And my creative agency likes to tell me that the people on their team go to the pharma side of the business to kill their creativity because of all of our regulations. And I think that it creates a fun challenge. What we see ex-pharma or outside of pharma is a lot of great best practices of understanding a customer, following their journey, mapping their engagement points, building on that to continue to be a part of their lives. You visit a store, you can look at stuff in a store, you can remember it on your phone, it can follow you back to wherever you go from there with follow-up emails. You didn't check out this. Do you think this rug might fit your table that you're looking at? And it creates this experience that goes with you, and that brings that brand into your life in ways that maybe you didn't even imagine you needed. And that aspect of how you create your brand and your product and your service to fit into someone's life is something that we've learned a lot from. Now, some of the ways how we do it are different in pharma because it is a more regulated area. And when I think about the content, when we create content and we need to create it for 5 different segments of customers, and within each of those we have 4 different personas. Suddenly we have 20 different sets of content that all need to get reviewed and approved by large committees and go through a very rigorous process to even be placed out into the world. And so those are some of the complexities and resource limitations that come into play when we think about comparing pharma with non-pharma as it relates to omnichannel.
Yeah, and that's fair. And I mean, the other part of it is the evolution, the life cycle of the pharma industry. I guess these are starting days. We have a complexity of our end consumer not being our customer. So, not in a way. So I think that adds to it a bit as well, because then we, like you said, we have different personas. Segmentation has been done in a very different way till now. And now, you're starting to now question whether you should know more about your customer. So obviously it takes a few miles to even get there where you can start implementing it. I think first part is to understand it, internalize it, and the organization moves in that direction from a cultural perspective. And then, you think about designing it well is when you can think about what is possible from a personal perspective with the rep in the field, and then what can be possible from a non-personal perspective. So So that is very well answered. Thank you, Melissa. So I think the last thing I wanted to cover on this episode was, we covered a lot about the what part of it. And we covered a bit of the why as well. But can you throw a bit of light on the why omnichannel in pharma? Precisely from a perspective of what is the value to the HCP, and what is the value to the rep, and what is the value to the organization, the manufacturer, the pharma manufacturer.
Yeah, I don't think that companies can afford to keep doing what they've been doing in the old pharma model, where the rep relies on only face-to-face and you deliver your 2 key messages and you count your success in sales. There has been so much change that we've all experienced over the past couple of years. And our customers are not going to respond if we're not meeting their needs. And the only way to meet their needs is to understand them, and to understand beyond how they're prescribing your drug or your class of drugs, but to understand more about who they are as a person, what they're trying to accomplish with their patient care and in their professional life. When you know that, and you know where they get information, what's important to them, when and how you can best engage them to provide education, to have a discussion, a dialogue about their needs, then it becomes much more about your story and how it fits into their lives and meeting their needs. And that builds that trust, and that builds a relationship that goes beyond a face-to-face visit. And that is really important to carry through into the digital world, especially as access continues to change for reps to get to doctors. And I know a lot of reps, and we've talked about mythbusters, a lot of reps worry when they hear the word omnichannel. Oh, this is just a play by marketing to replace my job. But truly, the folks that are in the field meeting with customers, medical science liaisons, key account managers, the rep force, sales force, they are all orchestrators of that customer experience and critical components of your brand's relationship with the people that care for our ultimate customer, the patient. And at the end of the day, that's who we're all trying to support in the best possible way. And the more that we can understand how the doctors are trying to do that, then the better we can support them with that. And when they feel that and they see that in our engagements, we're bringing what's really relevant and helping, that's what will change behaviors. And if you don't bring that and you don't take the time to do that, to understand that, then you'll be left behind. Your competitors will.
Yeah, no, absolutely. I mean, very well said. I think that I know we are rushing a bit. We can go hours and hours on this, but I think probably take a pause there in terms of what we wanted to cover on episode 1. So we covered the what is omnichannel, what is relevant for pharma, why omnichannel in pharma. And I think we want to kind of continue this discussion into episode 2 when we actually get inside a pharma organization and say, how do we drive omnichannel? Where do we start? What are the strategic pillars? What are the key work streams that need to be taken into account to drive or to initiate a good omnichannel transformation? So any final thoughts before we close today's episode, Melissa?
I hope that we answered your question about what is omnichannel and why would I consider doing this for my customer. And as a parting thought, I would say if you're feeling unsure about your customer experience that you're creating, go and ask them. Run some surveys. Find a way to get their input on what that feels like, because that's how you'll know. And then
awesome.
You can go from there.
That's awesome, to end that almost like a perfect marketeer. So yeah, I mean, I think, and then I love the sound of the marketeer thinking about the field force there. So I think that is very powerful, because that is sometimes that is almost ignored when we are driving these transformations, because it's like you said a couple of minutes ago, they are the field force is the orchestrator of it. Marketing is going to shepherd it, help the sales force, but ultimately the uptake and the offtake is going to happen when the sales force embraces it, the field force embraces it, let me put it that way. So thank you so much, Melissa, for taking the time today. I'll see you in a few, and then we'll cover episode 2 together.
Thanks for
Thank you so
having
much,
us.
viewers, for watching episode 1. Thank you. Have a good one. Bye now.
Thank you for listening to another episode of Life Sciences Value Share with Gaurav Kandhari. We invite you to visit valuedoconsulting.com/podcast for additional resources and to access the notes to today's episode. Join us again soon and invite your peers and colleagues.